Hi guys. Hi guys, we're presenting over long COVID. This is Serenity Hessenflow with Abby Gerard and Alyssa
Brain.
Kerperine. Okay, so for a little bit of definition and background, long COVID goes by a couple different names: long COVID, post-acute COVID syndrome, post-COVID-19 condition, and long haul COVID-19.
And it is defined by the World Health Organization as of October 2021. So they define it as the presence of symptoms lasting for at least 2 months in individuals with a history of probable or confirmed SARS-CoV-2 infection. It can be continuous or relapsing and remitting in nature, and the time lag between microbiological and clinical recovery.
Long COVID can be divided into two stages: post-acute, which is longer than 3 weeks but less than 12 weeks, or chronic, which means it extends longer than 12 weeks.
So these are all the physical changes that are commonly associated with long COVID, but for this assignment, we're really looking at the dyspnea, um, dizziness, POTS, and maybe a little bit of chest pain.
And then for some cognitive changes, we really see some trouble with memory, concentration, and then brain fog and disorientation.
So emotional changes that happen with long COVID are anxiety, a sense of hopelessness, depression, and PTSD.
So the first assessment that we looked at is looking at dyspnea, and it's an assessment that measures one's difficulty breathing upon exertion. For this assessment, they complete a 6-minute walk and then they complete the scale, and it's based off of their own viewpoints of how their breathing was impacted during the walk. It is a standard method, and so you have to complete the walk and then answer the questions. It was done mostly for a population of individuals with COPD, but since long COVID is a little bit newer, there are some studies that are starting to look at it with long COVID, and they're showing the same results of reliable and valid measures. And then, although it is subjective, it is a reliable and valid test or assessment. Oh, sorry. The rationale for this test is it assesses dyspnea, breathlessness, and chest pain, which are all common symptoms of COVID. And then the secondary is it also gives us a chance to observe fatigue, weakness, dizziness, and POTS.
So then the second assessment we looked at is called the Rivermead Behavioral Memory Test, the third edition, or the RBMT3. So what this does, it assesses memory skills using everyday tasks like visual, verbal, recall, recognition, immediate and delayed everyday memory skills. And then it also allows us to monitor change over time because there's a test-retest option. And so originally they used this assessment with individuals with acquired brain injury, but since then they've really expanded to different conditions that memory's impacted with. And then what's nice about this one is at the end of the manual, there's a rehab chapter that gives ideas for interventions you can use based on how the individuals score in the test. And then it is standardized, so you have to follow exact administration procedures, but from what we looked at, it seems that the manual is pretty easy to follow and it's pretty straightforward. And then the main reason we chose this assessment is to focus on cognitive symptoms of long COVID, specifically memory, because we need it for a lot of occupations, so we want to know it's working before we can do any interventions. And then while we're doing this, it's pretty extensive. It takes about 30 minutes to do. So we could also look for physical symptoms like fatigue, and then some other cognitive symptoms like concentration and disorientation while they're taking it.
Our third assessment that we looked at is known as the Depression Anxiety Stress Scale, or the DAS-42. The rationale for why we chose this was found in an article which I think really makes a bold statement about the effects of long COVID. It says, for those recovering in post-acute stage 4 COVID, fatigue and long-term health consequences potentially interfere further with mental well-being. Long-haul COVID survivors experience many symptoms: fatigue, cognitive processing difficulties, limited occupational engagement for weeks or even months after the initial infection. 1 in 5 COVID-19 survivors is diagnosed with mental illness, depression, anxiety, insomnia, or dementia. despite having no previous mental health concerns. The DOS-42 is a standardized, or if modified, non-standardized self-report designed to measure clients' self-perception of their emotional states of depression, anxiety, and/or stress, all of which are affected by long COVID. It's a 42-item assessment, and it's used by many disciplines, so it's not exclusive to OT, which is really good because it can be kind of used across the board, and many professionals will recognize it, which can help bring more attention to long COVID and its effects. And then it's a scale of 0 to 4 for all of the questions that indicate how much the statement applies to the client. And it's over the past week. So one example of a question is, I found myself getting upset by quite trivial things, or I was aware of the dryness of my mouth. And you range of 0 from never, or 3 to almost always. And then in the end, there's a subscale because it is standardized if you complete all of the questions, and you can kind of gauge your score, which indicates normal ranges, mild, moderate, severe, or extremely severe rates of depression, anxiety, or stress.
So our first intervention, we really want to work on educating individuals on managing breathlessness in their ADLs and IADLs. So we're trying to teach individuals ways that they can do their ADLs and their IADLs in a way that helps them manage their breathlessness. So one way we could do that is introducing the 4 P's of breathlessness, which is plan, pace, prioritize, and position. So in that planning stage, we're really trying to help them figure out how to organize their day based off of which activities are best for the morning, the afternoon. We're trying to help them plan a way to avoid unnecessary exertion. And we want to maybe look at planning the week in advance, which is kind of what this activity diary on the side is showing you. So that way we can really make sure we're prioritizing the things that are most important. And then when pacing, we're wanting to incorporate balanced activity and rest throughout the week and use a consistent pace while completing tasks. For prioritizing, we want to determine which activities or occupations are the most important to them, and then possibly work on ways to delegate tasks that aren't as important so they can spend more time on those meaningful activities. And then for the position, we want to utilize their posture to the best of their ability so that way they can complete their occupations in a way that best fits for them. And then this activity diary is kind of a way to incorporate those 4 P's. They can plan their week, their day, and it's just a way that they can incorporate breaks and make sure that they can reach all their occupations. And then the rationale for this is we want to increase participation in activities or roles that an individual is having difficulty with due to breathlessness.
So then our second intervention, we wanted to do a functional task that worked on memory and overall cognition. So we wanted to do a meal planning and grocery shopping activity. So for it, we would have the individual pick a recipe they want to make and then plan out what they need and what they already have using the steps on the slide. And then this could be done as practice, so just making the list, going around the house, but not actually having to go out to the store. Or you could do the whole process depending on how comfortable your client is and what they specifically need. And then you could also grade the task, which is nice. So based on how many cues you give them, the complexity of the recipe, and how long you're doing the activity. So really, the main reason we wanted to do this activity is planning a meal and then going grocery shopping for it addresses almost all the cognitive symptoms you could have with long COVID, while incorporating a functional IADL that the individual could perform in their daily life. And then you could also address some of the other physical and emotional symptoms as well, just observing them while they're doing it. So the main part for memory is some examples. Try and memorize the foods needed from the recipe when you're writing the list. So have them read it, then remember what they need, and then go and write the list from memory. And then when they're shopping, have them read the list, maybe read 2 or 3 items, and then try to remember which items they need to go without reminding themselves from the list. And then for concentration and brain fog, just see how well they stay on task and if they start to drift off at all. For disorientation, just check while they're navigating either through their house or through the grocery store, depending on how severe it is. Just see if they're getting lost or they're forgetting what they're doing. And then some of those other symptoms, mainly fatigue, since this is moving around a lot and it's requiring a lot of brain power, just see how quickly they get tired. And then anxiety, if you are going out into a grocery store, this is a pretty serious illness that caused a lot of social anxiety in a lot of people just being around others and getting sick. So just working on that and seeing how well your client does.
Our third intervention that we wanted to address, some of the emotional and mental health aspects of long COVID, is progressive muscle relaxation and deep breathing. One reason I chose this intervention was because it can be used in many situations, so such as Abby's grocery shopping task. You could utilize this before, during, or after that. So this would be a really good baseline intervention to use. The description is this could be guided or independent depending on the client's comfort level and cognition, and you go through the steps of deep breathing and progressively relaxing muscles from head to toe. You can adjust verbal cues or visual cues as needed, and can even implement tactile cues if the client prefers those. The rationale are also from a study, CETA et al. Of 2023. The results of this study indicate that PMR, progressive muscle relaxation, can improve the sleep quality, anxiety, depression, and quality of life in patients with long COVID compared to usual care interventions. This just basically states that improving not only sleep quality, but the direct anxiety, stress, depression. Improving these clients' sleep is a really big goal because that, again, helps with stress levels, and then also just helps them with their fatigue and everything. So doing progressive muscle relaxation before bed can also really help sleep. This can be used in many different scenarios and contexts. Like I said, it's pretty discreet and can be pulled out whenever they're feeling their symptoms or their triggers. It's easily modifiable to fit the client's needs, and it helps manage/decrease the stress, anxiety, depression, pain, and fatigue. And it also promotes better sleep, mindfulness, and energy throughout the day. And here are our references. PubMed.